Hello, friends. There's a big dilemma of two big C's. The C that we keep hearing, the corona, and then the other C which we've been hearing a lot, that is cancer. So when you confront both, do you ceasefire or do you confront? So that's a dilemma that we're going to talk about. So today you open the TV, you see the messages, you talk to somebody. The topic is corona, corona, and corona. And then there is a lockdown 1, lockdown 2, lockdown 3, and we don't know what's going to happen after that. An important thing is that in these times when the cancer happens, the person is completely shaken up and he feels that he is between the deep sea and the devil. And one of the authors mentioned is a war on two fronts and the cancer care in the time of COVID-19. So that's what has been described about. So let's see what we're going to discuss today. Let me introduce myself. I am Dr. Ranga Rao, a cancer specialist from Paras Cancer Center in Paras Hospital, Gurugram. And today we're going to talk about the cancer management in corona times. So corona is going to stay, whether you like it or you don't like it. We have to live with it. At the moment, there's no treatment or there's no vaccine to prevent for now. But in times to come, I'm sure we will find both as we did for all other infections so far. The fear of corona infections in the cancer patient is real. It is not imaginary. It is very much real. And let's see what happens in a patient of cancer from the corona. Definitely, they are more susceptible to the corona infection because of the low immunity. Most of the infections are mild or moderate, and some do get serious. Mostly they recover, but some do have poorer outcome. And most important thing to realize is that these infections are totally preventable. Now, what about cancer? Should we not fear cancer anymore? Corona has overtaken it. It's not so. If cancer is untreated, it can be dangerous. It may cost somebody a life if untreated. It may cost a limb in some if untreated. It may cost an organ in some if untreated. It may decrease the quality of life in some if untreated. It may decrease the longevity if untreated. It may worsen the suffering if untreated. So cancer can be costly if untreated. So therefore, it is important to treat cancer as well as manage corona and prevent corona. That's what the way it is. So how do we do that? Is cancer treatment safe? Most of the experts feel that the cancer treatment is safe and should be done as far as possible. The Western people, because the hospitals are flooded with COVID patients, they are unable to get the treatment according to the priority of the cancer patients. The cancer survivors, you are safe. You continue with your treatment, whatever you are on. You could choose to delay your tests, stay at home, and teleconsult your oncologist, but you must stay in touch with him. The patients who are on treatment, please continue your treatment. The oncologist may feel some changes are necessary. Let him do it. In case he wants to change the sequence of treatment, please let them do it or let him do it. Follow the advice of the oncologist. Be in touch with them, but continue the treatment lest you lose the chances of cure or palliation, whatever the intent is. The new patients, you must consult. You must know the options of treatment. You must know the sequence of treatment. Discuss with the family. Discuss with the oncologist. Discuss amongst yourselves completely, and then choose a safer and easier treatment. Choose the right option for you, because the same option is not the best for all. Go to the nearest cancer center. You don't have to travel far off to the distant places. If possible, choose a corona-free setups. Have the least number of visits. Follow the advice strictly of the oncologist team. Teleconsult and be in constant touch with these consultant teams. Fight cancer regardless, never give up, and there's always a hope. For the corona infection, take all the preventive measures with complete sincerity. Maintain a very good hygiene, wear the masks all the time, and then if you have any coughs and sneezes, protect yourself, maintain safe distances, maintain a good hygiene, clean up the whole house, sanitize the house. If required, stay alone and isolated, have the least contact with the other people as much as possible, monitor if required, and in case you have problems, do consult your physician, and if required, you could choose to wear PPE when you're going home. Along with that, you must ensure that you stay fit, do exercise, yoga, meditate, then attend to your medical problems, keep the diabetes, blood pressure, heart problems all under control, eat well, sleep well, and have the least of the stresses in the world. Do not panic, do not fear, fight both corona and cancer, and prevent corona, treat cancer, and that's the only way to win over both. And wish you all the best. Thank you for your patient listening.